Assalamualaikum and a very good morning to all. Talking about the overwhelming demand for drugs to treat COVID-19, I would like to share my strategy in order to find new potential drugs specifically for this disease. Developing a new drug from scratch is a lengthy process, and this makes it impossible for us to face our current global challenge. We obviously know that COVID-19 has now been declared as pandemic and new treatments are urgently needed. This is how I came up with an idea to perform drug repurposing, as it is less expensive and it requires shorter period of time compared to the conventional method of drug discovery and development process. Drug repurposing is a process of finding new indications for the existing or shelved drugs, meaning that we are going to reuse the existing or the licensed medications for a new medical indication. So how would I do this? I would like to combine drug repurposing with the computational method, such as structure-based drug design, to make this drug discovery process become more accurate and efficient. This led to a new form of an idea known as in silico drug repurposing. This in silico drug repurposing will involve a combination of structure-based drug design and also molecular dynamic simulation. Both of these methods will help us to find the effective compound among the existing drug that will react or will give effect on the specific target protein. So let's explore more. In performing in silico drug repurposing, there are two most important compounds which we must have in order to start this process. The first one is protein, which will be extracted from protein data bank, and the second one is existing drugs, which will be extracted from the drug bank. So in this situation, I'm going to use antiviral drugs such as lopinavir and ritonavir, as COVID-19 is one of the coronavirus, right? So after we have extracted these two compounds, we have to identify their 2D and 3D structures. Straightly after that, we are going to introduce these two compounds into a software for molecular docking to be performed. In molecular docking, the previous protein will behave as a receptor which possesses binding sites, while the other one, which is existing drug, will behave as a ligand. So what is molecular docking? Molecular docking is a virtual screening approach to predict this receptor to ligand binding modes. After completing this screening process, the binding affinity between receptor and ligand will be calculated by using scoring functions, and the proper orientation of the pharmacophores inside the binding site will be inspected. This is when we can choose our possible or potential compounds, known as a group of hit compounds. So after we have identified the potential compounds, now it is time to test them in a more realistic environment, which is called molecular dynamic simulation. Molecular dynamic simulation is performed to see if the compounds really have any potential or not. After completing molecular dynamic simulation, related analysis will be performed, and lastly, lead compound will be obtained. This lead compound is one true hit compound obtained from a group of potential compounds just now. So when lead compound is obtained, this lead compound will be optimized and will be developed into a reliable drug. So this is how in silico drug repurposing will be performed briefly. The main objective why I choose in silico drug repurposing are to cut costs and also to save time as much as possible. So I hope this sharing will be beneficial to all of you. With that, I end my sharing session. Thank you for watching. Have a good day.